خلينا نطالع.
هو الآن clear?
Almost there.
Okay.
معنا أصيل الشريحي وحسام حسن بوعيسى وأنغيم إبراهيم. أصيل معه ماجستير بالهندسة الطبية من جامعة سانت بطرسبرغ الكهروتقنية بروسيا، وبكالوريوس بالصيدلة من الجامعة اليمنية. عنوان المحاضرة Using AI to Detect Leukemia, Random Forest Classifier Provides Hope for Improved Patient Outcome. You can start, please.
Good afternoon, everyone. My name is Assel. I'm here today to share with you some exciting research in using artificial intelligence to diagnose the leukemia. Do you know that leukemia is the most common cancer in children and teens? In fact, according to the American Cancer Society, about 3 out of 4 children are diagnosed with leukemia. Despite the advances in treatment, leukemia remains a challenging disease to diagnose, especially in its early stage. And that's why we try to find this algorithm. Our algorithm is using IL to detect the leukemia. We'll start with introduction of the algorithm, then we'll start with the background of our algorithm and the methodology that we used, and of course the results that we got, and an overview about the Python and machine learning. First of all, this article proposes an algorithm uses machine learning techniques to assist in earlier detection and diagnosis of leukemia using the complete blood count CBC tests results. I'll give you an overview about this. Leukemia defines a cancer of a blood and bone marrow, and of course, the statistics are approximately 60,000 new cases of leukemia are diagnosed in the US each year. However, challenges in detection and diagnosis is subjective and time-consuming tests, of course, and this has given us a potential for misdiagnosed. Our proposed solution was a new algorithm for detecting leukemia using random forest classifier. I'll give you more leukemia, which is cancer of blood and bone marrow that affects the production of white blood cells. There are types and subtypes for this leukemia: acute lymphoblastic leukemia, acute myeloleukemia, and chronic lymphocytic leukemia, and the chronic myeloid leukemia. The causes are genetic mutation, exposure to radiation and chemicals. However, the importance of early detection and diagnosis gives us a successful treatment outcomes, potential consequences of delayed and accurate diagnosis. The conventional methods for detecting the leukemia are simple and standards. They are standard tests and examination, which is CBC, bone marrow biopsy, and cytogenetic analysis. Limitation of conventional methods are subjectivity and need for training specialists to interrupt the results, potential for false negative or positives and diagnosis. However, the impact on patient outcomes gives us like a delay and accurately diagnose, and this can have serious consequences in the patient's outcomes. The algorithm that we proposed is using the random forest classifier, and as the figure shows, the algorithm. The key features of this algorithm is uses the CBC test results as input data, diagnosed to improve the accuracy and efficiency in diagnosis. The advantages of this algorithm is reduces the need for intensive or time-consuming tests and potential to improve the patient's outcomes through earlier detection and diagnosis. The potential impact in the healthcare systems could reduce the cost and improve the patient outcomes. Patient outcomes, and of course, machine learning and random forest classifier are new in this field and more better than other algorithms because this random forest classifier has the ability to handle large data sets and identify the patterns in complex data. The advantages of using the random forest classifier reduce overfitting and increase the accuracy compared to other machine learning techniques that we tried to use in the previous researches. The results that we got, our team developed an IL-based algorithm to diagnose the leukemia from the CBC tests. The algorithm uses the machine learning, as I mentioned before, and use the CBC test results to identify the abnormalities that are indicative of the leukemia. As you can see in this slide, our algorithm achieves an accuracy rate of 77.6% in diagnosed leukemia from the CBC test, which is significantly fair and the current standard of care. We also tested our algorithm on a data set by Qatar University, Doha, and Dhaka Medical Hospital, Bangladesh, contains 103 CBC test results, and it accurately identify all cases of leukemia and non-leukemia. The results are particularly significant given the challenges of accurately diagnosing the leukemia from the CBC tests, which can be difficult to interrupt and may not always be conclusive. And our algorithm has the potential to improve the early detection and reduce the need for further testing and intensive procedures. To put it simply, our algorithm can assist in diagnosis the leukemia from the CBC test, which could lead to earlier detection and better outcomes for the patients. The limitation and future directions, while our results are promising, there are still limitations, of course, to our approach. For example, our algorithm currently limited to diagnose the specific subtypes of leukemia, and we need to test it on more large data set to validate its performance. In the future, we are planning to expand our algorithm to diagnose specific subtypes of leukemia and integrate it in the clinical practice. As a conclusion, there is a potential improve in detection and diagnose and reduce burden in the healthcare systems. And of course, in the future research and developments, integration of the other subtypes of medical data, expansion of the algorithm to other types of cancer would be included in our researches. Thank you for your attention, and I hope you just get the most of this presentation.
Thank you very much. مين عنده أسئلة شباب؟ Did you prepare the الصور تبع الخط ولا الفيروس؟ كان في صور. Did you use the values of measured leukemia, or you used, or your work is based on pictures?
Well, we used. We use images of leukemia, yeah, blood tests.
Or on both, or just one?
No, we use 103 CBC tests, which is included from Qatar, Doha, Qatar University.
Okay. What type of preparation for the images did you use?
Well, as I mentioned, they were not images, they were CBC tests, and these tests are numbers, of course, including the white blood cells, red blood cells, and platelets count.
Okay.
And
okay.
these are,
yes.
And these are like new in this field.
Sorry, I had the impression that you used some pictures of the leukemia cells or something like that. Okay, thank you. Thank you very much. في حدا عنده بعد شي سؤال يا جماعة؟
Thank you for your question. I really appreciate your attention.
Okay, thank you very much, and we hope to see you maybe next conference here in Syria.
Inshallah. Thank you for your attention and have a good day.
Thank you, Assel. مع السلامة.